Hey, welcome to How It's Done, a podcast for curious marketers. I'm Christy Goad. I'll be your host, and I'm really glad you're here. Hello, curious marketers. Now that we're staring down the barrel of the fourth quarter, I thought this would be an ideal time to invite a guest with a finger on the pulse of what's hot and what's not in healthcare. Having recently been invited to a happy hour with the Jeffries Bus Tour here in Nashville, I of course thought of the one and only Brian Tanquilut, a senior equity analyst at Jeffries, covering the healthcare services sector. Brian's areas of focus include, hang with me, this is a long list, hospitals, drug distributors and retail pharmacies, value-based care, post-acute care, including home health and inpatient rehab, behavioral health, healthcare staffing, consumer health, including physical therapy, optometry, and dental clinics, diagnostic laboratories and imaging, outpatient surgery centers, durable medical equipment and distribution, and specialty pharmacy infusion. Whew, Brian, that's a lot. I don't know how you do it. Brian has been with Jeffries for more than 20 years, and he's been named a ranked analyst for his coverage of the healthcare services space by Institutional Investor Magazine and the Wall Street Journal. Welcome, Brian.
Christy, thank you so much for having me. Really appreciate you doing this, and I'm excited to chat healthcare today.
Well, I'm honored because you're everywhere. You cover a lot, as I've just mentioned this full list. I don't know how you do it. We do have a lot I want to cover off on, so let's just dive in.
Do it.
All right. Well, Brian, you and I go way back. We've known each other quite a few years here in this very close, healthcare community. But I was at a Sway Health marketing conference back in May, and the Sway Health folks presented some interesting facts and figures. And one of them I posted about because I thought it was super interesting. It was a by the numbers, like topics no one is covering in healthcare media. And on the list were probably some things that weren't too surprising, but maybe things that were a little bit surprising to some people. Those things that were not being covered, at the time were COVID-19, thank goodness, home care, SDOH, population health, IT infrastructure, and telehealth. And you had commented, made a comment about some of the factors driving why those just weren't a hot topic anymore. And I thought maybe we could just kick off by you sharing with our podcast audience why some of those things are on that list. Obviously, it's a follow the money thing, and you follow the money. So I'm just curious if maybe you can talk about that. And then I want us to dive into, healthcare headlines and trends. What's going on? What's coming up? What should we marketers and beyond, really be thinking about?
Maybe I'll start with the first part of your question, right? So what we're seeing right now is, if you look back 5-6 years ago, even before COVID, right, there was a lot of focus on social determinants of health. Home health was a key focus area for a lot of folks. And a lot of these buzzwords, right? You go to an AHIP conference and everyone's talking about supplemental benefits, and telehealth was big, obviously, post-COVID. And what we're seeing right now is that a lot of these things are being, I don't want to say they're sunsetting, but they're being faded by the payers. So what's happening is post-COVID, obviously there was a little bit of pent-up demand that was in the market. And so we saw a little bit of a pickup in utilization, kind of like in 2022, 2023. But now that we're past the whole COVID kind of like normalization of trend in healthcare, what we're seeing is that a lot of these insurance companies are struggling with high medical loss ratios, much higher than they had expected, specifically in the Medicare Advantage world. So what's interesting to me is, as these companies, the Uniteds and Elevances and the Blues plans of the world, as they were trying to figure out how do we manage our margin, right? When more people are going to hospitals, clinics, and all these things, what do we do, right? And what I'm hearing, at least from where I sit, is that top of mind is we got to pull back on some of these benefits that were, kind of like viewed as ancillary, maybe not completely necessary, but good to have, with idea like social determinants of health would be one where, if we feed our populations better food, give them access to transports, overall health and well-being would improve over time. You were involved with disease management back in the day, right? That's the whole idea, is that it's an investment in the person's health. But as the dollars, as you said, you follow the money, follow the dollars, as the dollars are getting squeezed, they're saying, okay, I need to manage near-term earnings, near-term margins, and they're just looking at the easiest levers to pull. And so what we're hearing is that a lot of these health plans are saying, okay, we don't need to pay for transports anymore. We don't need to give cash cards these Medicare Advantage populations that we have. Food programs are being pulled back, and even home health, because Medicare Advantage plans started sending home health to patients' homes in order to help them, improve their daily living. And that's what it is. So as we think about 2025, you're going to see a dramatic decline in what we call supplemental benefits. So all these programs, I mean, I know there's a lot of marketing that has happened in social determinants of health, because obviously there's
a lot of dollars
there's a little bit
in those areas. Yeah.
Yeah, there's a lot of consumerism that you got to factor into those programs and make them effective. They're getting pared down. Transport is number one that we're hearing. If you remember, like Healthways, where you used to work, had the program Silver Sneakers, right? I mean, and that's another program that we're hearing is going to get pulled back quite a bit next year, because it's like gym memberships are not top of mind right now, right? And that's not where the plans want to spend their dollars. So, and the cash cards, I mean, that was a big thing, especially in some markets like South Florida, where they were essentially giving grocery gift cards to members of the health plans, right? So that's an easy lever to pull. And so that's what we're seeing right now, right? I mean, it's a struggle to the insurance companies translating into reduced benefits for Medicare Advantage lives next year. So the follow-up question then is, what happens to Medicare Advantage, right? And I think what you're going to see is that while we've seen a spike in enrollment in Medicare Advantage over the last few years, where the balance has shifted from traditional Medicare enrollment to more people enrolling in Medicare Advantage plans, I think that shift kind of slows down a little bit when the benefits are not as rich in the Medicare Advantage side of the equation.
So does that have a trickle-down effect into commercial?
Commercial is interesting. We haven't really seen MLRs or medical loss ratios spike as much, or they're not as drastic in terms of how they've gone up post-COVID. So to me, what it also shows you is that the MLR, or the rise in utilization that we're seeing, is primarily in the senior population. So I think there's a big demographic component here, which, again, for marketers, I think that matters, right? It's like tailoring your marketing strategies to a senior population versus a commercial population. But yeah, no, I think commercial is okay. Commercial is stable. Now, some of that, obviously employment is one thing that we're watching, because a lot of commercial insurance is employer-based. But for the most part, I mean, for the health plans, I mean, the moneymaker really is in Medicare Advantage right now, right? So that's why this is a big deal for the insurance companies that are in the market.
Yeah, it's interesting. It's just a reflection of what's going on in larger society, right? The cost of everything is going up. We hear a lot of conversation out there about the cost of bacon, and just people in general, consumers cutting back. It sounds, completely analogous, like, hey, okay, those were nice to haves when things were rocking and rolling, but we got to tighten our belts a little bit, and this is where we have to cut. Is that also a reflection of government payment rates in Medicare, or not so much?
One of the things is probably more political than not, where the Biden administration has been tighter on the Medicare Advantage plans. I think, generally speaking, the Republicans are very pro Medicare Advantage, and they want to promote growth in Medicare Advantage. The Biden administration has been more stringent, and they've changed some rules that are impacting how much money the Medicare Advantage plans are making. So that's kind of the issue there, is that we've seen a little bit of compression in premium dollars that are being paid to these Medicare Advantage plans. And so that's definitely factoring in as well.
I gotcha. Tell me a little bit more about this Jeffries Bus Tour. Thank you for the invitation to the happy hour when you guys were doing that here in Nashville. And I met some really interesting folks in the finance space who were here for that. It sounded like a great event. And I know that you guys are sort of just ginning that back up after COVID years. Tell us a little bit more. What is the Jeffries Bus Tour? How does it work? What were some of the key takeaways from that?
Yeah. So first, Nashville, obviously, it's always been a healthcare town, but I think it's becoming an even bigger healthcare town where it's not just hospitals that are based here. So I think within the investment community, there's a greater appreciation for what Nashville has become in the healthcare world. And so I'm based here in Nashville, I've been here for more than 20 years, and taking advantage of the networks that we've built around here. We do an annual bus tour. So this was our 12th annual bus tour here in Nashville.
Oh, wow. That's awesome.
Yeah. So, and the event has grown. When we first started this, literally one of us would be driving the van, driving around the city to bring investors from all over the world to these headquarters of healthcare companies. But where we are today, we had a big group. We had a big, the biggest bus that you can hire in Nashville was what we had. But also we had events that we built around it where we're inviting both local healthcare executives and investors and putting them together in a room just to kind of like network. But more than that, I think the key is that we had, a good number of healthcare companies and their C-suites presenting basically open Q&A to give the latest and greatest views on what's happening in the healthcare world, right? And so, we had the likes of HCA, Community Health, Acadia Healthcare, Surgery Partners, some of these big name Nashville companies. And then because of you rattled off the names or the sectors that we cover within healthcare and the size of our bus tour, we've had companies from out of town also say, hey, we want to be part of this, right? So we had a bunch of company management teams come to Nashville just for this event. What's interesting? I think that over the last 2 years, the top discussion points within the healthcare space are, number one, utilization, right? We just talked about how MLRs and utilization have been really strong or high, and that's impacted the insurance companies. Well, the flip side of that is healthcare providers have seen very good years, right? The hospitals are thriving, or at least the publicly traded ones have done pretty well. I think that outpatient surgery centers have done well. So across, labs, go up and down the list, we've seen that level of utilization translate into, good earnings results, good stock performance. And so the question for a lot of investors is, how sustainable is this, right? Is this something that's still pent-up demand from COVID or carryover demand, or is this more of a trend that will continue? So a lot of the companies, a lot of the management teams were pushed and questioned on that. The second thing is labor, right? One of the things that we saw across the economy, right, was labor got tight. And then obviously with the Fed raising rates, there was this push to slow down inflation. And what we're hearing now from a lot of the healthcare companies is that labor is starting to stabilize. Like the inflation and wages for healthcare labor is probably trending more in the low single digit range today versus something as high as 10% 2 years ago. Right. So that's obviously a good thing because, as you know, Christy, like the healthcare space is very labor intensive, whether you're a hospital or even a retail clinic or whatever that may be. Right. So it's nice to see that number one cost factor that goes into operating a healthcare company, which is labor, is flattening out. And then the last thing we're seeing, which is another key discussion point, is Medicaid. Medicaid used to be a bad word in terms of reimbursement. Like as a healthcare provider, you want as little Medicaid as possible because they don't pay enough. What we're seeing today is that a lot of the states are realizing that, number one, it's hard for Medicaid members to access healthcare because the providers don't want their patients, right? And then the other side of it is, as we're seeing struggles within the healthcare industry, whether that's hospitals in rural markets, shutting down, or just different clinic groups going bankrupt. The Medicaid plans are also realizing that, in order to maintain access within healthcare in our states, we need to raise reimbursements. So what we're seeing is that there are lots of states that are approving what we call supplemental payments. And these are hundreds of millions of dollars that are being paid primarily to hospitals to raise their Medicaid reimbursement rates. And so it's become a windfall for a lot of hospitals across the country. For us here in
really
Tennessee,
interesting. Yeah,
for us here in Tennessee, the state legislature passed a big increase. The governor signed it, and they submitted it to the federal government, to CMS, about 3 months ago. And so we're waiting to hear back from CMS. Should be in the next 30 to 60 days on what's going to happen there. And if it happens, if CMS approves it, like I said, it's hundreds of millions of dollars of incremental payments to hospitals here in the state of Tennessee. We're seeing that in other markets like New Mexico, we're hearing Alabama, Indiana, and a few other places are considering doing similar programs to shore up Medicaid reimbursement and help the hospital industry in those markets.
So does that mean we should then have fewer headlines about the closing of rural hospitals out
That's the
there
hope.
in America? Yeah, I mean, it's
That's the
interesting.
hope, yeah.
I was just on vacation out west in like Oregon and Northern California, and it's just a bunch of really small communities. And I think I saw maybe one hospital sign, and it really made me think. And I think they were, opening a new one, but it just really brought it home. When you travel into these communities where, I mean, they're really far away from a larger city, with access to that kind of care. It really brings it home just how important those facilities are. So that's really interesting to hear that.
Yeah, so I think it's that, right? It's that realization from state legislatures and their governors that, hey, you know what? A lot of communities, especially as you get out of the big cities, don't have access to healthcare. And if you think about rural communities, the hospital is the center of care, right? The doctors are part of the hospital. Everything is done through a community hospital. So I think it's nice to see it. The Biden administration has been very supportive of these efforts, and so they've been approving a lot of these state programs, and there are more states that are trying to pursue these supplemental payments.
I gotcha. Well, it is interesting because, the first part of our conversation was really heavily focused on the payers and, what they're doing for their medical loss ratio, and then seeing like what's the flip side impact on providers. We have clients in the revenue cycle management space, and one is coming out with a state of claims report, and it's a survey that they did 2 years ago. And then this newest survey, it's kind of got some, interesting findings. The most interesting, I think, being increase in claim denials and more worry on the part of providers about not feeling technologically ready. And I think, on the flip side, I saw a story in Modern Healthcare just this morning about Aetna rolling out, some AI automation around utilization management and prior approval. Yeah. And all those things. And so, what I'm seeing out there is like, okay, like you can just see the battle play out, and it's like payers are really investing in technology to be able to be better at, managing their margins and making sure that they're doing what they can on the claims and payment front, whereas providers have kind of had this windfall, as you mentioned, but they really, post-COVID, they really stepped back a lot on technology investment and, the whole telehealth investment. It's been interesting to watch that trajectory of telehealth. It's like, oh, it finally took off and everyone loved it and people still like it, I think, but post-COVID, you see a lot of folks backing away from it.
So let's talk. There are two things here. So let's split out telehealth and then the revenue cycle side. So on revenue cycle, I'll start with the idea that, look, the payers, obviously they're big companies with a lot of scale and a lot of money to invest, have actually invested in AI tools that, like you said, the Aetna example today where they can use AI to run prior authorizations. They're using AI to scrub bills, right? So, and part of the payer move, right? It's part of their strategy is to delay payments as much as possible.
Right.
Try to screen out, right? You're trying to screen out whatever you can avoid paying, where if it's inappropriate or it's just not properly documented. So running technology through that process allows them to automate it and obviously operate at a lower cost, but also it makes it more accurate and more precise. Now, the flip side of that is your point too, right? I think that during COVID and since the post-COVID world, when we were seeing really, really high inflation rates, a lot of these hospital systems were forced to balance or make the decision, where do we spend our money? Right? Do we spend it on nurses and capacity because demand's picking up, or do we spend it on CapEx, whether that's IT or physical hospital beds? And as you can imagine, a lot of those dollars were spent on temporary, temp nursing, contract labor, to drive up capacity and make sure that hospitals are able to provide care. I think fast forward to today, the hospitals are realizing that they need to, and not just hospitals, but a lot of provider groups, that they need to invest in technology, whether that's AI driven or whatever that may be in revenue cycle, because it feels one-sided, right? Where the payers are running at an advantage because they've got AI tools that are helping them deny claims. So on the other side, you kind of have to play catch up, right? So I think you're going to see some investment on the rev cycle side, or just AI capabilities to drive efficiencies in back office. And so we're hearing a lot of that.
Can I ask you a question about that? Because I've been having some conversations lately, and there's a theory, and maybe it's not just theory, maybe it's reality, but revenue cycle, that function within hospitals has always historically been, like, okay, yeah, that's revenue cycle. They're over there in a, like a closet somewhere. And, not necessarily seen as hugely strategic, I guess. But I'm hearing conversation that maybe that's shifting, that maybe is becoming a lot more on the radar of CFOs.
I think it is.
Hospitals and health systems. Why do you think that? What are you hearing?
It's sad because I think the level of denials has gone up. We're hearing that, especially from hospitals. There's this dynamic called the 2 midnight rule. There was a rule change that happened late last year that basically, if you cannot keep a patient for more than 2 midnights in an ER. So once they're with you for 2 midnights, you got to push them into an inpatient admission, which obviously is more expensive. As a result of that, the payers have become more stringent in paying the bills, right? They're screening these bills out and filtering, and they're denying a lot of bills because kind of like you need to show medical justification to keep that patient for more than 2 midnights. So that's the 2 midnight rule. And that, I think, has been the key driver of, always, the managed care companies are always looking for ways to delay and deny claims. But this was a real inflection point for them where they're like, we need to figure out, if we're going to pay more just because of a new rule, we need to figure out what's appropriate and what's not. So for the provider, they've seen a spike in denials. And as a result, right, if you're a CFO of a hospital and you're not getting paid for a certain patient, it becomes a big red flag. And it has impacted cash flows for some hospitals. And that's what's forcing the hospitals to reconsider whether it's investments or outsourcing of revenue cycle, right? If the payers are going to do something, we need to fight it back.
Yeah. And the Change Healthcare data breach, which brought everything to kind of a screeching halt, I would imagine, really elevated that conversation as well in the C-suite.
Yeah, it did. And part of it is that, some hospitals got squeezed really hard because they were not getting paid for weeks, right? So they had to tap bank facilities or whatever cash sources that they had just to keep the lights on, right? And I think we're just now starting to get that resolution really showing up in P&Ls and cash flow statements for a lot of these providers.
Yeah, interesting. What should we be? What should us marketers and communicators in healthcare be? For us as an agency, we start looking at, okay, what are some of the year-end and then 2025 trend stories that are going to start coming out, and where we can plug in our folks as thought leaders. And I'm curious what you see on the horizon where you think those, trends and headlines are going to be focused.
Maybe before I touch on that, I forgot to answer your question on telehealth.
Oh, yeah. Telehealth. Sorry about that.
Yeah. Telehealth is interesting, right? Because telehealth obviously picked up in terms of adoption rates during COVID. And there was a camp during that time that thought that this was the catalyst for us to shift the way we delivered care to more telehealth, right? It's more efficient. A doctor can sit at an office or in their homes and deliver care. They can moonlight, and so you're expanding capacity. What we've seen, though, is, and this is actually interesting, maybe it kind of answers your marketing question as well, right? Is what we've seen is that the use of telehealth, whether that's primary care, specialty, or even behavioral health, right, has declined post-COVID. And what it shows you, at least from where we sit, is that patients still value the direct relationship with a physician, right? Because in most telehealth situations, you don't know who you're going to see, right? You're like clicking on something, You see a doctor, the next time you click, it will be a different doctor, most likely, right? But what it shows you is that there is loyalty, there is value in the direct patient relationship with their clinician, or at least U.S. patients value that, right? Because in other parts of the world, we've actually seen telehealth utilization kind of stay stable, but in the U.S., it has declined quite a bit. So, so if you're thinking about, from a marketer's perspective, just considering that idea that patients are loyal and they appreciate the direct interaction with their clinicians. And now, if you're a telehealth company, I think there's a marketing aspect in there as well, right? I mean, it has become a truly direct-to-consumer type of business at this point, whether you look at behavioral or primary care. Now, specialty is a little different just because you're getting referrals from a primary care for the most part, right? Yeah. I mean, for specialists. And then maybe the other side of this, I mean, maybe to answer your question too, like, what are we looking at? Where are we seeing kind of like trends? One of the things that we're watching really closely, for example, in the pharmacy space, CVS is shifting their revenue model in the pharmacy world to where they call it it's a cost plus model, essentially, or a transparent model. And their view is that the clinician relationship with the patient, meaning the pharmacist-patient relationship, is important. And we need to get paid for that clinician's time. And we're going to split that away from what they pay, from what your payer insurance company pays for the drug. I think that's a really interesting topic because there is, at least from the pharmacy's perspective, they're saying that the pharmacist is actually more of a trusted clinician and partner in healthcare for a patient than a primary care doctor.
Yeah.
Which is actually interesting, right? I mean, if you think about that, but if you think about whenever you get your drugs, you have an effective consult with your pharmacist. Like, they ask you, do you know how to use this? Do you know side effects? I mean, they walk you through your drugs. And a lot of seniors especially love that interaction with a pharmacist, probably more so than the doctor, maybe because it's easier to get a conversation with a pharmacist than getting to your doctor's office, right? And then they're trying to shuttle you out every 5 minutes. But I think that's one area that could be interesting, just strengthening that relationship and the value of the pharmacy going forward, especially as we've seen some of these pharmacies struggle, whether that's Walgreens or Rite Aid, right? I think making that push to establish the pharmacist as a clinician and as a key healthcare relationship partner for a patient, I think there's something there. And then there's a lot of focus on price transparency, whether it's especially in drugs right now. I mean, you have the Mark Cuban cost plus strategy. Obviously CVS is rolling this out. So I think trying to figure out how does price transparency factor into patients or employers' decisions to pick a specific pharmacy, right? Copays obviously matter. Value-based care is one that's kind of fading a little bit right now, especially in primary care. A lot of value-based companies are struggling. So, again, that was one area where, years ago, I mean, not that long ago, like marketing was focused a lot on value-based care because you're trying to bring patients into these value-based care practices, whether you're VillageMD, One Medical, Oak Street. I think that a lot of them are having a difficult time right now. They've burned through a lot of cash. And so I would say you're probably going to see a little bit of a fading in terms of marketing dollars out of value-based care companies.
Interesting.
Value-based specialty is an emerging area where there's probably some investment that's happening.
I see a lot of activity in MSK in that.
Yep, MSK, cardio. And part of it is back to your original point earlier, right? That you follow the money.
Yeah.
And if you think about where a lot of dollars are being spent today, it's joint replacements, cardio, and behavioral health. So, and then dialysis, right? Kidney care, right? So that's where the money is flowing today. It's not in value-based primary care. It's more in these value-based specialty, buckets that are considered high dollars.
Well, I'm really curious about that. You mentioned telehealth, and we look at behavioral health. I mean, we are basically in a crisis right now in the country, maybe the world, from like anxiety and mental health, and then access to those services is really difficult. So there's a lot of companies that have been born, and I imagine a lot more are going to start to be formed and founded in that space. And I'm just curious, from a telehealth perspective, that does seem to be one of the sectors where if you need that kind of help as a patient, as a consumer, like you'll take whatever you can get, whether it's on the phone, whether it's in person, like you just need somebody to help you. Do you think that's a true statement? What are you seeing in that space in terms of trends and where that's going and how people differentiate themselves? I mean, there's only so many therapists in the world.
I'll start with, look, I mean, you're definitely spot on when you say that there is a lot of demand and a lot of need for behavioral health services, whether that's therapy, addiction treatment. I mean, we obviously have a big opioid crisis. Acute behavioral care is much needed right now. Like suicide ideation rates are some of the highest levels we've seen ever, right? So it clearly shows that there is a lot of demand for this, but not enough supply of clinicians. I think the challenge that we're seeing, when you look at companies that are involved in telehealth specifically for behavioral, you've seen volumes come down. And the problem in behavioral is payment, right? So most folks probably cannot afford to keep paying out of pocket for behavioral services. And that's the biggest challenge. What we're seeing is that companies that can provide behavioral services, whether it's in person or through telehealth, that are able to charge insurance are the ones that are thriving and continuing to grow, while the direct-to-consumer model is starting to fade. I mean, it was easier to make that push during COVID, right? When people were at home, they were not spending a lot of money anyway. They had extra dollars to spend for teletherapy. I think today, the patient out-of-pocket market has shrunk significantly. And part of it is like broader inflation. We talked about that, right? Like people need to watch what they're spending their money on. And, it's one of the things that people are pulling back on is therapy, especially if it's not considered acute or if it's not emergent.
Right.
But we cover a company called LifeStance Health, and their model is, their referral, they have very little money spent on Google searches and online advertising. A lot of their money is spent marketing to primary care physician groups and saying, okay, your acute or semi-acute behavioral patients, refer them to us. And we have a hybrid model where we can do teletherapy or we can do in-person, and we take insurance. Because if you've ever been to therapy, a lot of therapists actually do not want to take insurance because it's such a pain to get reimbursed, and they don't have any leverage with insurance companies, and they get paid bad rates compared to what they can charge as a direct-to-consumer business. So I think that's what's happening in the behavioral world. Now, addiction is a different animal, different story altogether. So many flavors to addiction, right? I mean, there's the IOPs and there's some virtual models that have emerged here in Nashville. We've seen some of those. I think those are still thriving just because we have, the big opioid crisis still ongoing. And there's actually a lot of money that is allocated towards rehab, partly because the drug distributors and the retail pharmacies have signed very big, multi-billion-dollar settlements with the government to spread dollars to help address the opioid crisis, whether it's through education, law enforcement, and treatment. So for that reason, there's a lot of money that's going to anything addiction related.
Follow the money always.
That makes sense.
Well, Brian, we are running out of time here. I hope that you will come back. Maybe we could even make it a regular quarterly appearance, since things change so often and I know you're super busy, but I'm just going to throw that invitation on the table. You're welcome to come back anytime if you're willing.
Anytime, Christy.
What have we not covered that we absolutely should not miss out in terms of looking at trends and headlines?
Well, elections.
The election.
I think it's a tough one,
right?
That's
taboo. No, just kidding.
Yeah,
did you watch the debate?
Watch the debate, but I think it's more about what can actually be changed in healthcare. And I think the reality of it is that while we're all focused on what happens with the presidential elections, I think the key things to think about are, for anything big to happen or change in healthcare, you need Congress, right? And so unless Congress is aligned with the White House, both in the House and the Senate, you're in gridlock. And there's nothing significant that will happen. And I think any poll that you look at shows that we'll probably have a split Congress. So I don't think you're going to see any changes to the Affordable Care Act or the IRA as a result. Now, obviously, the administration can put through administrative changes we'll see what happens. I'm not trying to be political, but it's the reality of it, right? But I think if we're worried about, the ACA going away, I don't think there's appetite for that in Congress, even from the Republican side. The IRA is going to be hard to eliminate or repeal. So I'm not expecting much change in healthcare going forward.
Yeah, I agree. That was kind of my takeaway from the debate last night. It didn't sound like either candidate, whoever wins, is going to really be doing too much tinkering with Affordable Care Act.
And it feels like, I think the focus areas for both presidential candidates are areas outside of healthcare.
Yeah.
Right. I mean, it feels like it's immigration and economy, which probably is not a bad thing, at least from a healthcare perspective.
Right. They definitely impact what's going on in healthcare, don't they?
Yep, exactly.
Well, I appreciate you bringing that up. How could we not talk about the election?
I think that's a topic for another day.
just a few more weeks left in that. I think that'll be interesting to see what happens there. But, well, thank you so much. I really appreciate you being on. We usually end with a burning question. So my burning question for you is, I'm just always curious, what everybody's reading, especially, those of us who are really healthcare animals, what's your go-to media sources day to day, week to week?
Yeah. Reading lists are Beckers. I think I learned a lot from Beckers, Modern Healthcare, Politico, and CQ HealthBeat.
CQ HealthBeat. I'm going to have to add that to my list. I don't take a look at that too often, but Awesome. Thank you, Brian. Well, as always, we will include links and background on you, Brian, and Jeffries, and anything that you would like our listeners to be sure to have access to. We'll include that in our show notes. So listeners, do be sure to check out those on our website, growwithfuoco.com/howitsdonepodcast, or wherever you get your podcast. And don't forget to hit the subscribe button so you never miss an episode as we continue to cover all things healthcare, marketing, PR, and communications. Again, my guest today has been Brian Tanquilut, Senior Analyst with Jeffries. Thank you, Brian. I hope you have a great day, week, month, fourth quarter.
Thank you, Christy. Always nice chatting with you, and I'm sure I'll see you around.
Absolutely. You too. Ciao for now.
All right. Sounds good.
That's it for now. Thanks so much for listening. We're looking forward to keeping great conversations coming your way as we grow this podcast. There's even more great content from our conversations on our blog. Be sure to check it out at growwithfuoco.com. That's growwithfuoco, FUOCO.com. Stay tuned until next time, and no matter what, stay curious.